Hi, my name is Carla. I'm going to be your nurse for today. I'm going to provide us with some privacy and do some hand hygiene. Can I verify your name and date of birth?
Cadence Vaughn, 0409-2003.
All right, perfect. I have some orders from your provider to do a head-to-toe assessment. Can I ask if you are allergic to any medications, or do you have any allergies to anything?
No, I did not.
All right, since we've already done your vital signs, we'll go ahead and get started, okay? All right, so I'm going to start off, I'm going to check your lungs. I'm going to do a respiratory on you first. Okay, so based off your vital signs, you had a respiratory rate of 16. They were deep and unlabored, so that was good. So we're going to go ahead and take a listen. All right, and I would be checking for her lungs underneath her shirt on her bare skin. All right, so I'm going to check your right upper lobe, your left upper lobe, your left lower lobe, your right lower lobe. And can you just lift your arms up front? You'll go check laterally. Alright. Alright, I'm gonna have you just slouch forward. Alright, I'm gonna do your right upper lobe, your left upper lobe, then your left lower lobe, and your right lower lobe. Alright, I'm gonna listen laterally again. And while I check for those lung sounds, I'll be having the patient take deep breaths each time I touch the stethoscope on you. Okay, so do you have a cough or anything? No? Alright. Well, whenever you do have a cough, I'll advise you to do the turn and cough method where you lay on your side, you take a deep breath and you cough to help expel any mucus that you may have or sputum. And then I also have this is called an incentive spirometer. This is supposed to help expand your lungs and strengthen them. So what you're gonna do with this is you're gonna take a deep breath and then exhale out. So I'm gonna have you do that for me real quick. All right, good job. Okay, and with that, it's going to prevent infection, like it's going to help prevent pneumonia. It's just going to help strengthen those airways in your lungs so you can expel any unwanted mucus or anything. All right, so next I'm going to check your heart, okay? All right, so first I'm going to have you at a 45-degree angle, and I'm going to check for any jugular vein distension. So I'm going to have you turn to your left. All right, that side looks good. All right, I'm going to have you turn to your right. Okay, that side looks good. I just want to ask, do you have any chest pain, any shortness of breath lately? All right, that's good. Okay, so first I'm going to listen to your heart. All right, I'm going to listen to first your aortic valve, and then your pulmonary valve, and then your Erb's point, your tricuspid, and then your mitral or your apical pulse, and I'm gonna count that for a full minute. All right, and then with the other side, with the bell, I'm going to listen for any murmurs or any abnormal heart sounds. All right, so I'm gonna check for your capillary refill, and I'm gonna check for any clubbing of your fingers. I'm going to check for capillary refill. All right, so that's less than 2 seconds. That's good. Next, I'm going to palpate for some edema. So I'm going to start from your lower extremities up. All right, can I see your arms? Okay, and next I'm just going to count your pulses. I'm going to two. All right, you did really good. All right, so next I'm going to do a neurological assessment. So I'm going to have a series of questions for you, okay? All right, so what is your name?
Cadence.
Who is the president?
Biden.
Where are you right now?
School.
Why are you here?
To learn.
Okay, well that's good. All right, so this doesn't pertain to you, but according to the Glasgow scale, You have a score of 15, so that's really good, so that's a perfect score. So next I'm going to do is I'm going to do a musculoskeletal assessment on you, so I'm going to check your range of motion with your joints or anything. Do you have any joint pain? Have you heard anything lately? No? Okay. Alright, so I'm going to have you extend your arm out. Okay. I'm just going to have you flex. Alright, extend. Alright, I'm going to add some resistance, so flex again. Alright, and then extend. Alright, so that's good. Next I'm going to do with your wrist. Alright, I'm going to have you hyperextend. And then just extend. And then flex. Right, now I'm going to add some resistance. Alright, that's good. Now I'm going to have you resist down. Alright, that's good. And I'm going to do that bilaterally. So I'm going to do it now to your lower extremity. So I'm going to do it to your knee. Alright, so I'm going to have you flex, or extend, I mean. Alright, that's good. I'm going to have you flex. Alright, now I'm going to add some resistance. Can you extend for me? Now can you flex for me? Alright, you did good. Now I'm going to do it to your ankle. Alright, so I'm going to have you, plantar flexion down and then dorsiflexion. Alright, so I'm going to have some resistance. Okay. Alright, that's good. I'm going to do that bilaterally. Okay, so next I'm going to do is I'm going to have you gait. I'm going to test your gait, have you walk from the chair to the door. Alright, and now you coming back, I just want you to look straight up and walk heel to toe back to the chair. Okay, and that's good. Now I'm going to do the Romberg test. So I'm going to test your balance, have your arms straight out. Hold that. Okay, that's good. You did good. I'm going to have you sit down now. Alright, lastly I'm going to inspect your abdomen. I'm just going to ask, have you had any abdominal pain or anything? Mm-hmm. No? Alright, so I would check this on bare skin. I'm going to see if you have any lesions where your belly button is, or your umbilicus is. And then just check for any unexpected findings. Okay. And then next I'm going to do is I'm going to inspect your bowel sounds. So you don't have any tender areas. Mm-hmm. Alright, so I'm going to start from the right lower quadrant and move clockwise. Right lower quadrant, and then the left upper quadrant, right upper quadrant, and then the left upper quadrant, and then the left lower quadrant. Alright, and then I'm going to palpate. So I'm going to feel your right lower quadrant, your right upper quadrant, then your left upper quadrant, and then your left lower quadrant. Alright, so everything feels good. I just have to ask, do you have any trouble passing about, having a bowel movement, or and you can urinate normally?
Yes,
Good?
I can.
When was your last bowel movement?
Like yesterday.
And that's normal for you?
Mm-hmm.
Alright, well, I'll just note these, or send these findings to your provider, and he'll be in with you shortly, okay?
Okay, thank you.
Mm-hmm.